Are we ready?
Doctor, we are live.
Dear friends, good afternoon. Welcome to Brain Teasers. Today, Brain Teasers in association with Delhi Ophthalmological Society and Microvision is presenting a mega quiz. Now, it's my privilege to invite Dr. Namrata Sharma Madam, a bundle of energy, omnipresent lady from All India Ophthalmological Society, Secretary of All India Ophthalmological Society. Ma'am, few words of introduction and of this quiz today. Over to you, ma'am.
Thank you, Dr. Prashant, and it is a pleasure to be on this Brain Teasers platform again, which has become so very popular. And you do this month after month tirelessly, and everybody waits for it. So, thank you for doing it yet again for Delhi Ophthalmological Society. And I'm sure it is going to be a great contest with many people who will be participating in it. And best part is that it is from postgraduates to practitioners, so it encompasses the all the age groups who are going to be a part of it, and everybody is entitled to a prize, a cash prize, if I may say so. And thank you so much, Dr. Prashant Bhavankule, Dr. Shilpi, I know, who's been helping in this very diligently, and Microvision for supporting us in this venture. Thank you.
Thank you, ma'am.
And Sai, I forgot, Numerotech, who's very nicely and very painstakingly made this very unique platform.
Thank you, madam, for your kind words. And we wish the participants on behalf of you the best of luck. And now we have a very unassuming, thorough gentleman, a man of integrity, President of Delhi Ophthalmological Society, Professor Dr. Subhash Dadia. He would be speaking few words to the participants, a few words of encouragement and guidance. Please. Dadia, sir.
Thank you, Dr. Prashant, for inviting me here again. And it is second quiz with DOS. So I would like to thank Brain Teasers, Microvision for associating with us in this quiz in which basically the basic aim of which is talent exists everywhere among PGs to practitioners. So I would like to thank on behalf of Delhi Ophthalmological Society to you, Brain Teasers, Microvision, and Mr. Sai. And I extend my best wishes to all the participants and congratulations in advance to the winners. Thank you.
Thank you, President, sir. Thank you, President, sir. And so this is Brain Teasers for you. Dear friends, welcome and good afternoon. Again, I welcome you for today's mega quiz by Brain Teasers, which is in association with Delhi Ophthalmological Society and is kindly supported by Microvision. Let me introduce you all to the concept of Brain Teasers. Brain Teaser is an edutainment initiative which was introduced last year by Sarakshi Netralaya Nagpur. Brain Teaser is a live online quiz conducted once a month on a web-based platform on first Sunday of every month. Also, it's no longer just a quiz now. It's much more. To increase your learning and knowledge, we have niche sections like Pearl of the Month and Wisdom from the Heroes in Ophthalmology. This episode for DOS, we are introducing our inspiration. These are short interviews of heroes who scaled the height of success by their sheer grit and hard work. We are having three guests who are stalwarts in the field of ophthalmology and who will be sharing wisdom and inspiration with us today. I welcome Professor Dr. Atul Kumar Sir, Chief, RP Center, New Delhi, Professor Ritu Kumar Ma'am, Director, Guru Nanak Eye Center, and Dr. S. Bharti, Director, the Bharti Eye Hospital. Friends, their stories are worth listening and emulating. Their stories tell us that even you can do it. Of course, with zeal, determination, focus, and integrity with which these people reach the top. And there is no shortcut to top, is what their story tells us. Sincere thanks for accepting our invites, sir and ma'am. Today is a special day for Brain Teasers. It's our proud privilege to associate it with one of the largest test society, and I'm thankful once again to DOS executives for this opportunity. Special thanks to Dr. Subhash Dadia, an unassuming, straightforward human being, and more importantly, a good friend of mine and president of Delhi Ophthalmological Society, and the bundle of energy and omnipresent lady and secretary of DOS, as well as All India Ophthalmological Society, Dr. Namrata Sharma, for this honor which you have given to our Brain Teasers. Brain Teaser with DOS has conceived this mega quiz for you all. And remember, today we have more than 1.2 lakh rupees at stake. Also, the winners will get certificates. Today's episode, we will be streaming live on Facebook and YouTube for people who are just interested to watch and learn, but not play or participate. No mega event is possible without the generous financial support of a farmer. My heartfelt thanks to Mr. Ashok, Executive Vice President, Microlabs, for standing rock steady behind us, and an untiring effort by Mr. Navneet. Also, I need to thank Mr. Sai and his team from Numerotech for the technical support which they have been offering us day in. Sharing the mantle today, along with me from the house, is Dr. Shilpi Navre. Today is my co-quiz master. Welcome, Dr. Shilpi Narnavre. And now I hand over the screen to Dr. Shilpi Narnavre for explaining you the rules of the game. Thank you.
So, good afternoon, everyone. Here are the rules for today's quiz. Who can participate? Yes, any ophthalmologist from a PG to a practitioner, from kids in ophthalmology to the great veterans in ophthalmology. Quiz has 6 sections and 5 questions in each section. The format is every question will have 4 options. Only one amongst the 4 is correct. So you have to select the correct answer only after the timer starts and later click the save button to record your response. If you are not sure about the correct response, don't be in a hurry to click the save button because once you click the save button, you cannot change your response. This is what the participants will see on their screen. This is a sample question for your understanding. Identify the character shown in the picture. Option A, Tom. Option B, Jerry. Option C, Donald. Option D, none of the above. Now here the answer is B. The timer will start and so you have to first click the B option and then click the save button to record your answer. So who wins the prize? Naturally, the first 2 answers correct and answers fastest, that is fastest finger first. We don't want seniors and juniors at loggerhead, so we have 2 categories of prizes. One for the people below the age of 40 years and second for above 40. So what are the prizes? Every section will have 1 winner. It means we have 6 section winners in each category, and that's not all. For the whole session of 30 questions, we have 2 mega prizes, one for the runner-up and one for the winner in both the categories. That means in total, we have 12 section winners, 2 runner-ups and 2 winners. Remember, you can be a section winner only for one section, but don't give up. as you can win the session prize with your consistent performance. If there is a tie for a section, the cumulative performance of all the 6 sections will be considered. But if there is a tie for the session winners, that is runner-up and winners, the dice will decide your fate. In case of any discrepancy, the judge's decision will be binding. Now look, what is at stake today? Prize money of rupees 5,000 for every section winner. Runner-up gets the prize money of rupees 10,000 and the winner carries away 20,000 rupees. It's not only the gifts. Winners, you will be invited live for the concluding ceremony where you will share the screen and interact with our today's guests who are the who's who in ophthalmology. So winners, be alert. You will be sent a Zoom link as well as you will get a call on your registered mobile number. You will have to join the platform as soon you get the confirmation. So tighten your seat belts to play the quiz. Now I request Dr. Prashant Bawankure sir to start the game.
Stop karela. Yes, friends, are you ready there? Yeah, okay. So we begin our section 1. The clinical condition depicted here has an association with all the following shown except, and here are your options. Time starts now. I'm sure most of you must have guessed it right. And the correct answer is option C. So this is a pedigree of a recessive inheritance. So what was the condition? It was an Axenfeld-Rieger syndrome. And it is a autosomal dominant, not a autosomal recessive pedigree as shown in option C. So what are the clinical features you see? You see is a prominent Schwalbe's line, posterior embryotoxin, and hypoplasia of iris. And this happens because of the defect in differentiation, migration, or arrested development of neural crest cells. And that's why you get abnormalities in eyes, teeth, and facial structure. So now moving to the question 2. Look at the cornea carefully. This ocular condition, corneal condition, is associated with all except, these are the options, option A, B, C, and D. And your time starts now. Yes, so I hope you guessed it right. Yeah, the correct answer is option D. So what was the ocular condition? Yeah, it was a Wilson's disease and the cornea was showing Kayser-Fleischer ring. Yes, KF ring and Wilson's disease gets exacerbated in females who are having IUCD in the form of copper T. Similarly, in a Wilson's disease, hepatic cirrhosis happens leading to copper deposition causing hepatic damage as well as degeneration of basal ganglia in Wilson's disease. But what was wrong, what was not fitting into this puzzle was the pigmentary retinopathy. Pigmentary retinopathy is not an association of Wilson's disease. It is not a feature along with Kayser-Fleischer ring. So now let's move to the next question. Question number 3. Again, a corneal condition. Look at the cornea carefully. This corneal condition in a child may have a following additional signs except. Your options are here. Option A, B, C, and D. And your time starts now. So only one of them is not associated with a corneal condition. Yeah, time is over. And the correct answer is option D. So option D does not fit into the category. So what was the corneal condition? It was interstitial keratitis which is seen in congenital syphilis. And the option A which was given was a dark field microscopy showing spirochetes, which is a causative organism for syphilis. And option B was a perforation of heart palate. And option C was a Hutchinson's teeth. Both are features of congenital syphilis. While option D, which was given to you, was a Charcot's joint, which is a disorganized ankle joint, which is seen in tertiary syphilis, not in congenital syphilis. In congenital syphilis, the bony involvement is in the form of periostitis of metacarpal bones. Easy? So let's now move to the next question. Question number 4. This pupillary condition can be associated with all except one of the options shown here, A, B, C, and D. And your time starts now. Yeah. So this is a case of an anisocoria, and option C, which was given, is a pseudopapilledema because of Drusen. So what happens? In anisocoria can be associated with option A, which is raised intracranial pressure. It can be associated with esotropia in the form of lateral rectus palsy. It can, and fields will show enlarged blind spot. Yes, you can have a disc edema, but it is the picture which was shown was a pseudopapilledema because of a optic nerve head Drusen. Easy. So now let's move to the last question of this section. Look at the pictures carefully. The top picture is before intravenous injection and the bottom picture is post injection. Can you guess the test which is done and the condition? Well, you are supposed to tell following can be associated with the condition. So I'm not asking which condition is this and which test is this. I'm asking one of this condition is not associated with this particular disease and the test shown. And these are your 4 options. Your time starts now. And the correct answer is, this is a electromyography and this is a normal EMG. So exactly, everyone must have guessed it right. It is a myasthenia gravis where we do a positive tensilon test. And the X-ray which was shown was of a rheumatoid arthritis. Yes, patients who are with rheumatoid arthritis on a prolonged penicillamine treatment can develop myasthenia gravis. Option B, which was given, was an electromyography, but it is normal. What happens in a myasthenia gravis? There is a decremental response to repetitive nervous stimulation. So EMG here was normal. Had it been decremental response, well, it would have gone with the myasthenia gravis. The option C was shown was a caliber bean, which, and what does caliber bean contain? It is an anticholinesterase physostigmine from which it is extracted from it, and it can be used to treat myasthenia gravis. And option D was thymoma, which can occur in myasthenia gravis. So this is the end of the section 5. And now I request Dr. Shilpi to take over to section 2.
So the question 6 of today's quiz is, in regards to congenital cataract, which option is most likely to be correct? So your options are, option A, dense bilateral cataract should be removed before 3 months of age. Option B, residual myopia is targeted while calculating IL power. Option C, posterior capsules should be diligently preserved. And option D, postoperative visual acuity is usually better in patients with unilateral cataract than bilateral cataract. And your time starts now. Time is up. In regards to congenital cataract, the option which is correct is dense bilateral cataract should be removed before 3 months of age. So extraction before 3 months of age, before the fixation develops. IL power initially, we should kept it at hyperopia, it should be targeted in consideration of the future myopic shift. Primary posterior capsulotomy and interior vitrectomy prevents posterior capsule opacification. Postoperative visual acuity is poor in unilateral cases compared to the bilateral cases. So now coming to the 7th question, during phacoemulsification, linear distance that tip traverses to produce an impact on lens material is called as option A, stroke length, option B, occludability, option C, frequency, option D, all of the above. And your time starts now. So the time is up and the correct answer is stroke length. Yes, stroke length is the length of the needle movement during to and fro movements, while occludability is the tendency of the tip to get occluded and it builds up the vacuum. Frequency is the speed of the needle movement. Stroke length power varies by varying stroke length and frequency. Tip selection depends upon the lens removal technique and the hardness of the lens. While the low frequency is less efficient, the higher frequencies causes excess heat. So coming to the third question of this section, look at the images shown on the right side and the question for you is, peripheral corneal edema with central clear cornea of unknown etiology post-cataract surgery is called as option A, Ellingson syndrome, option B, Uretz-Javelia syndrome, option C, Brown-McLean syndrome, and option D, none of the above. Your time starts now. Time is up. And the correct answer here is Brown-McLean syndrome. Yes, it is peripheral corneal edema, which starts with the inferior cornea and it progresses circumferentially. Incidence is seen more in the ICC cases and least with the phacoemulsification. Usually it is a self-resolving condition. In some cases, you might need to start with the hypertonic saline and topical steroids. Only in the refractory cases, you need to treat them surgically. Ellingson syndrome is a UGS syndrome which occurs because of the mechanical trauma due to the malpositioned IOL. Pigmentary dispersion can cause raised IOP, microhypemas, and uveitis. Uretz-Javelia syndrome is seen usually after penetrating keratoplasty in keratoconus patients, and it is also seen after DALK and DACT, in which you will get the fixed and dilated pupils. So the next question is, which of the following is correctly matched? A, phenothiazins causes small vacuoles in anterior lens capsule and epithelium. Option B, miotics cause pigmented deposition in anterior lens epithelium. Option C, amiodarone causes the stellate anterior axial pigment deposition. And option D, statins cause posterior subcapsular cataract. Your time starts now. So the correct answer here is option C, that is amiodarone causes stellate anterior axial pigment deposition. Phenothiazins, the antipsychotic drugs, causes pigment deposits in anterior lens epithelium, while miotics cause the small vacuoles in the posterior and anterior lens capsule and epithelium. Statins, they do not increase the risk of cataract surgery. In fact, they reduces the risk by 50% over 5 years. And the correct option, that is amiodarone, which is an antiarrhythmic drug, it causes cataract in the form of stellate anterior axial pigment deposition, and it also causes corneal deposits and optic neuropathy. So coming to the last question of this section, all of the following statements regarding the image shown is true except. Look at the image on the right side and which option is not correct. Option A, it can occur due to the indirect rupture of the sclera. Option B, predominant site of scleral rupture is superotemporally. Option C, it can occur after perivulvar anesthesia. And option D, it can occur due to direct rupture of the sclera. And your time starts now. Time is up. And the correct answer here is B. Predominant site of scleral rupture is superotemporally. The image shown is phacocele or lenticele. It is the subconjunctival dislocation of the crystalline lens, which occurs following blunt trauma. It can be due to direct rupture or indirect rupture. The predominant site is superonasal, and the second most common site is superotemporal. Also, it is reported after peribulbar anesthesia. So with this, we end with our section 2. And now it's my proud privilege to welcome Padmashri Retinal Services at RP Center, AIIMS, New Delhi. He was Honorary Advisor to Government of India in 2016, Honorary Consultant at AFNC from 2015 to 2018. He was awarded BMA Best Medical Teacher Award and UGC National Hariom Ashram Trust Award by the Interaction Between Science and Society in 2019. To his credit, he has 16 book chapters, 298 publications, and 5 books. So, welcome you, sir.
So, although you require no introduction, but just let me begin by introducing Professor Atul Kumar, who is not only a proud Dr. B.C. Roy Award recipient, but has also been bestowed with the Padma Shri in 2007. So it's a huge privilege for me to be here to ask you, what has your journey been from just being a medical aspirant to being an ophthalmologist par excellence?
Well, it's been a trying period for me initially. I had a lot of hardships. I lost my father very early in my first year of my career. And so I had to work very hard because this kind of setbacks affect your studies and everything. But anyway, I could manage to my residency here. RP Center is one place I could get my merit, my serial residency. Because of that time, because we had just 1 or 2 seats settled. We had interviews for faculty in the year 1987, so I was fortunate to get a selection in the faculty. Dr. Vasisneha Harper was the director, and Professor Bharat Mohan was the secretary. So they had one interviews, and so the journeys continued, and it was lots of ups and downs, overall, it's been satisfying, and I've done a lot of service for the poor, and I feel that that's helped people center with us. I've always enjoyed treating the common man. And these common people have often no place to go to, and they want to stay apart. Technology and surgery, which we have at our center. Right now, we've got a very beautiful setup which matches anywhere in the world. And residents also train with us here, and they use the same equipment, so they train well. That's my aspiration. That I want to train as many residents as I possibly can. So that they can go ahead.
Shilpi, can you stop sharing your screen? I will play through my end.
Okay, sir.
We are not getting adequate thing. That's why I will go through my laptop.
So although you require no introduction, but just let me begin by introducing Professor Atul Kumar, who is not only a proud Dr. B.C. Roy Award recipient, but has also been bestowed with the Padma Shri in 2007. It's a huge privilege for me to be here to ask you, what has your journey been from just being a medical aspirant to being an ophthalmologist par excellence?
Well, it's been a trying period for me initially. I had a lot of hardships. I lost my father very early in my first year of my junior residency. And so I had to work very hard because these kind of setbacks affect your studies and everything. But anyway, I could manage to do my junior residency here. And sometimes with God's grace, I could get my merit, get my senior residency because that time, because we had just 1 or 2 seats. And then, we had interviews for faculty in the year 1987. So I was fortunate to get a selection in the faculty. Dr. Sneh Bhagwa was the director, and Professor Madan Mohan was the academic officer, the chief. So they ranked me one for the interviews, and so the journeys continued, and was lots of ups and downs, bumps and lumps, as they say, RP elevations. But overall, it's been satisfying, and I've done a lot of service for the poor, and I feel that that's helped the people in general and also RP Center because I've always enjoyed treating the common man. And these common people have often no place to go to, and they want state-of-art technology and surgery, which we have at RP Center. And right now, we've got a very beautiful setup which matches anywhere in the world. And residents also train with us here, and they use the same equipment, so they train well. And that's been my aspiration, and it's this thing that I want to train as many residents as I possibly can in the RP Center, and so that they can go ahead and future they can do very good. So that's been one of my feelings, strong feelings, is to treat the common man, do a lot of service for the poor, irrespective of any caste, creed, religion, and also train residents the hard way. Sometimes I get to a little too stiff, but it's basically to help the residents.
Sir, so carrying forward this conversation, sir, how has this prestigious institute, Dr. Rajendra Prasad Center for Ophthalmic Sciences, evolved from your post-graduation days, sir?
Well, the building was, thanks to Professor L.P. Agarwal, is the visionary, the legendary person. I was fortunate to not only work with him, but fortunate to know him. And he was, of course, that time retired chief, but very thorough gentleman. And since then, I think RP Center has evolved. Technology-wise, we've evolved tremendously. Techniques and technologies involved. We've got state-of-art technology in every specialty. You take cornea, cataract, everywhere. We've got brachytherapy unit here, new one, 3 years back we got it. And of course, retina is par excellence, glaucoma is par excellence, trismus is par excellence, cornea, cataract, refractive surgery, name it, we have the equipment. I don't want to take names of any equipment, but I think we've evolved technology and techniques. We've got a beautiful surgical lab, and where we can train our first and second semester residents. So we give a lot of importance to residents.
So any word of advice for the young ophthalmologists just beginning their careers right now?
I think they should work hard and devoted. Stay devoted. Stay devoted and work hard. Don't lose sight of the path, and study as well as see things, be practically and sincere to your work. I think that's what I would like to say.
Thank you.
Thank you.
So thank you, Professor Atul Kumar, sir. Yes, it's sheer hard work for a common man like you, common individual student who became the head of the center of RP Center, who becomes the director of RP Center. It's a story which anyone would love to follow and love to emulate your steps. Yes, friends, remember, young friends who are watching and playing with us, nothing comes on a platter. You have to create the path, and the only words of advice you can hear from the people who have made it. And what did he say? It is sheer hard work, grit, determination, and no shortcuts. So with these words, now let's move to the section 1 and 2 winners. So it's my proud privilege to announce that section 1 winner, less than 40 years, is Dr. Amok Kitur from Delhi. And section 2, and above 40 is Dr. Venkat Subramaniam from Bangalore. While the section 2 winner is below 40 is Prerna Singh from Patna, and above 40 is Dr. Shailesh from Bangalore. Congratulations to the winner. So keep tuned, keep playing for the session prizes, and do not forget to log in at the end of the show. So now let's move ahead. Now coming to the section 3. Yes, friends, don't relax. Still, people who have not made it as a section winner, you still have a chance to catch up with them. Yes, so section 3 begins here. Plateau iris leading to angle closure is because of which underlying anatomic derangement? Option A, abnormally concave iris configuration. B, abnormally thin iris stroma. Option C, anterior position of ciliary processes. And option D, all of the above. And your time starts now. Yes, a relatively easy answer. I'm sure most of you must have got it right, but who was the first? That is important. So plateau iris leading to angle closure is because of which anatomic derangement? It is because of anterior position of ciliary processes. So what happens in a plateau iris syndrome? Here the iris is flat and there is an anterior positioning of ciliary processes and there is a thick iris root which all contributes it to become a angle closure glaucoma. And the treatment of choice here is iridoplasty and not iridotomy, as we do in other narrow angle glaucomas. And that is the difference here. And so what do you see on a clinical? Double hump sign. And the pictures here show that. Now coming to the question number 2. Definitive signs of glaucomatous damage include all except A, splinter hemorrhages on optic disc, B, vertical elongation of the cup, C, loss of the nerve fiber layer, D, peripapillary atrophy. And your time starts now. So one of the three is not associated with glaucoma. Which one is the odd man out? I think most of you must have got it right. Yes, it is peripapillary atrophy, which is not a sign, definitive sign of glaucoma. So what are the definitive signs of glaucoma? It is loss of nerve fiber layer, which has to be seen with IR photographs, vertical elongation of the optic curve, glaucoma flecans, which is the changes which happen in the lens because of acute rise, and splinter hemorrhages of the disc. So this was the answer. Now let's move to the MCQ 13. Risk of developing steroid-induced glaucoma is increased in all conditions except. So risk of developing steroid-induced glaucoma is increased in all conditions except. Option A, myopes. B, history of primary open glaucoma. C, history of angle closure glaucoma. D, diabetes mellitus. And your time starts now. So steroid-induced glaucoma is the question. And it can happen in association, but for one time. And here ends your time. And the correct answer is history of angle closure glaucoma, which is not associated with steroid-induced glaucoma. In fact, steroid-induced glaucoma is a secondary open angle glaucoma, which happens because of increased resistance to outflow at trabecular meshwork level. And it is associated with primary open glaucoma, myopia, diabetes, and sometimes with rheumatoid arthritis as well. So now moving on to the next question. So question number 14. False about the visual pathway. So the three options are going to be right. One is wrong. Option A, lower nasal optic fibers traverse chiasma inferiorly and anteriorly. B, upper nasal fibers traverse chiasma superiorly and posteriorly. C, macular fibers decussate throughout chiasma but concentrated anteriorly. And option D, lesions compressing the anterior chiasma in conjunction with post-fixed chiasma leads to junctional scotoma. So one of the conditions is not associated, is wrong about the visual pathway, one of the same statements. Yeah, and the correct answer is macular fibers decussate throughout, that is option C. So this is what you should remember and should be impressed on your brain so that you can answer any of the questions related to optic nerve and optic tract, the fibers decussation and all. Now moving to the last question of section 3, MCQ 15. Diabetic patient presents with following fundus photograph and FFA. I'm not asking you in this question, what is the diagnosis? I'm asking you the most common differential diagnosis of the condition depicted in this picture. A, anti-AION, B, NAION, C, papilledema, and D, none of the above. And time starts now. This condition shows we want the closest differential diagnosis of the condition shown. I'm sure most of you must have guessed the question condition, that is diabetic papillopathy. And the most common differential diagnosis here is NaION, which you need to differentiate. How do you differentiate? Remember, diabetic papillopathy has a polar type of a disc edema. Not whole disc is uniformly affected. Here, the visual acuity is quite good, and visual fields might show central scotoma or peripheral constrictions. While in NaION, the disc edema is abrupt, it is diffuse, and it is associated with significant visual loss. And importantly, on a perimetry, you get a altitudinal visual field defect. And that is the closest differential diagnosis of a diabetic papillopathy. Now let's move to the next question. Sorry, we have completed the section 3, and now I request Dr. Shilpi to go ahead with section 4. Over to you, Shilpi.
Thank you, sir. So half of the quiz is over. Let's move to the section 4. The first question of section 4 is, which one of the following statements regarding clinical condition found in right eye of this 73 years old woman is true? Option A, biopsy of the adjacent conjunctiva may show increased plasma cells. Option B, corneal perforation will occur rapidly. Option C, systemic immunosuppressives are contraindicated. And option D, it is a painless, slowly progressive process. And your time starts now. So time is up. And the correct answer here is option A, biopsy of the adjacent conjunctiva may show increased plasma cells. So this is a case of a Murren's ulcer in which pain is usually severe. Older adults, usually perforation is rare in such cases. In young patients, it is bilateral and it progresses rapidly. So the systemic immunosuppressives are often necessary in these cases. So these are the closest differential diagnosis which are for the Murren's ulcer, that is Sterren's marginal degeneration, pallidal marginal degeneration, senile furrow degeneration, and peripheral ulcerative keratitis. So coming to the next question. Intacs have got FDA approval for treatment range of option A, -6 to -8 diopters of myopia. Option B, +2 to -2 diopter of spherical error. Option C, up to +3 diopter of hyperopia. And option D, -1 to -3 diopter of spherical equivalent. And your time starts now. So the time is up, and the correct answer is option D, that is -1 to -3 diopters of spherical equivalent. Intacs are arc-like PMMA segments which are placed in posterior mid-feral corneal stroma. It displaces the lamellar bundles and shortens the corneal arc length. The advantages of Intacs are this: the explantation is possible, so that is, it is reversible. It can be replaced with ring segments also, and it is approved for myopia of -1 to -3 diopters spherical equivalent. So coming to the 18th question of this session, Dresden protocol is a name of A, scientist, B, patient on whom it was first done, C, it is the name of the university where it was invented, and D, the machine producing UV light for C3R. And your time starts now. So time is over, and the correct answer is it is the university where it was invented. So Dresden, it is a current standard protocol for C3R, in which 30 minutes of isoosmolaric riboflavin is instilled over the deepithelialized cornea, and then it is irradiated for 30 minutes at 365 nanometer and 3 milliwatt per centimeter square, which corresponds to a fluence of 5.2. So coming to the next question, following are true about embryonic origin except A. Corneal endothelium, neural crest. Corneal epithelium arises from surface ectoderm. Conjunctival epithelium arises from neural ectoderm. And sclera is from mesoderm. Your time starts now. So the correct answer here is option C, that is conjunctival epithelium does not arises from neural ectoderm. Yes, it arises from surface ectoderm. So coming to the last question of this section, unique complication of femtosecond laser corneal refractive procedure is A. Loss of section, B. Diffuse lamellar keratitis, C. Regression after treatment, and D. Opaque bubble layer formation. And your time starts now. So time is up, and the correct answer is option D, opaque bubble layer formation. So this is a unique complication which occurs from when laser photo disruption fails to dissipate, and it becomes difficult to visualize and perform the lenticular dissection. Management is usually wait for the bubbles to disappear and gently massage them out from lenticular interface. So with this, we come to the end of the section 4. Now, till our backend team is ready with the results, let us hear from the legend Dr. Ritu Arora about her journey in ophthalmology.
Good evening. I'm Dr. Neha Sandhu, currently working as an SR in cornea unit in RPC. Today we have Dr. Ritu Arora with us, who needs no introduction. She is an epitome of hard work, dedication, and discipline. After taking training in the retina unit in RPC, she moved to GNAC in May 1991, where she became the pioneer in establishing cornea unit and started eye bank services and various corneal transplantation surgeries. She has more than 87 publications in esteemed journals all over the world. Currently, she is serving as the director of Guru Nanak Eye Center. Your accomplishments as an ophthalmologist are truly an inspiration for all the ophthalmologists, aspiring as well as practicing one. Ma'am, what motivated you to choose ophthalmology as your profession?
What basically motivated me to choose ophthalmology was because I was always interested in a surgical branch while I was in my MBBS. And so I was talking to a lot of different doctors in different fields, whether I should go for general surgery or, and then there were very few female general surgeons at that time. I'm not sure if there are few right now. And we only had one professor who was a female general surgeon. The rest all were male, a male-dominated field. And so not very sure whether it would be the right decision for me to take up general surgery as a profession. The other options given to me were to go for OBGY or ophthalmology. And again, OBGY I never liked. So by default, you can say I came to ophthalmology. Plus, I was also always interested in plastic surgery. So I thought that this way I'll get to do a lot of microsurgery. And of course, the scenario has completely changed in the last 30 years as far as the ophthalmology, what we joined as postgraduates and what it is right now. But I've enjoyed every minute of this specialty.
I'm looking at your career path. What has been the most rewarding point of your career so far?
most rewarding path for my career has been that going into the unexplored fields. The most rewarding first was a successful setting up of HCRP in Guru Nanak Eye Center with LNJP and GB Pant. And since I was so convinced about this particular, so I've gone on and on. It's been now almost 20 years that we have a successful HCRP running. And now what gives me further pleasure, or whether you can say happiness, is that when I get the LinkedIn, requests from the children whom I had operated.
And besides being a great doctor, great surgeon, and excellent teacher, you're also the director of the well-renowned and prestigious Eye Institute of the country. How do you maintain your work-life balance while ensuring excellence in your work?
No, it's not difficult. I think what is basically needed is to have a time management, and your priorities have to be at the correct. And of course, not to forget your passion. So your passion for work, when you do a proper time management, nothing is difficult. You can always allocate your time, this much time for your OPDs and this much time for your surgery and this much time for your admin. Everything is possible. And second thing is to, bring up good juniors so that you can delegate the work to them and depend upon them, so that they're like-minded people. So way of thinking is the same, and we achieve a common goal.
What advice would you like to give to all the young aspiring ophthalmologists?
Young ophthalmologists, I think the things are different now. It's more of a tech area, and people tend to depend more on tech than on their clinical skills. But I would really say that do not forget your clinical skills. Hone them. Work as hard as possible in your wards. Never neglect them. Because there's so very often what your eyes and what your fingers can pick up, a machine can miss. So keep on working at that so that you become an excellent doctor, become very good clinical skills, and always have your thinking open.
And what development do you expect to see in the field of ophthalmology in the upcoming years?
I'm sure there are lots which is happening in the stem cells. It's going to be an era of stem cells, and of course, development of artificial corneas. So, and of course, technology is going to take over completely. Maybe something may happen that you don't have to open the eye and the cataract gets done. Maybe that day is not far off. And of course, lots happening in the refractive surgery, so that you have the safety and capacity to correct the biggest refractive errors.
Thank you so much, ma'am, for your valuable time.
We are still waiting for the back-end office for the results to come in. I think we'll declare the section 3 and 4 winners in between the whenever we are ready with it. Thank you, Ritu madam. It was great, inspiring thing. And what you put across to the young student is that work-life balance, what you spoke about, should never be an excuse for not performing. See, that is what we need to learn, young friends. Remember, she's a lady who is a ophthalmologist par excellence, and she's not shying away from learning even at this age. She has accepted gracefully an administrative job, which she said she was lacking in. And so accepting your own weaknesses and working over it is what we learn from Professor Ritu ma'am. And thank you, madam, once more. Be with us. We will continue with the quiz part of it right now. And let's move to the next section. So section 5. This is the last section I would be doing. Following that, section 6 would be this is large, but one, I should say. So modified NAPS procedure is used to treat cases of A, congenital monoocular elevation deficiency, B, acquired monoocular elevation deficiency, C, monoocular elevation deficiency with horizontal deviation, option D, Brown syndrome. And your time starts now. So the correct answer is modified NAPS procedure is used to treat cases of monoocular elevation deficiency with horizontal deviation. So explanation. So what is NAPS procedure? It is done for monoocular elevation deficiency where a tendon of medial rectus as well as lateral rectus are transposed to insertion of superior rectus. While in modified NAPS, a partial part of tendon of horizontal rectus are transposed there, which is done for MED with associated horizontal deviation. And what is augmented NAPS? Here the NAPS procedure is combined with posterior fixation suture on a horizontal recti. So now coming to the next question, MCQ 22. This is a 5 years old amblyopic child who presents to your OPD with acute onset facial flushing, irritability and vomiting, and one of the pupil is dilated. The most likely clinical diagnosis is A. Atropine toxicity, B. Third no palsy, C. Horner syndrome, and D. Traumatic mydriasis. And your time starts now. So the answer was relatively easy. This question was easy. It was a case of a atropine toxicity in a young child. Traumatic mydriasis, unless history of trauma is there, third no palsy usually is not seen in kids. So atropine toxicity, what are the signs which you see? You have a fever, dry mouth, facial flushing, nausea, vomiting, irritability, and tachycardia. And the treatment here is immediate discontinuation of atropine and supportive measures. Horner syndromes, well, you have never have a mydriasis. In fact, you have meiosis, and there can be no flushing because there can be because he has anhidrosis. Third, no palsy and trauma. There is no history, neither is the age. So now coming to the next question. The most consistent finding with accommodative esotropia. So most consistent finding with accommodative esotropia. Options. A. DVD, that is dissociated vertical deviation. B. Acquired, that is onset from infancy up to the age of 4 years of age. C. Poor to no binocular potential. Option D. Cycloplegic refraction of +8 diopter. And your time starts now. The correct answer is option B. It is acquired. So it is the most consistent finding of all the four. So what is accommodative esotropia? It has an onset from infancy to 4 years of age, where a hypermetropia of +7 diopter is seen. +7 diopter leading to bilateral amblyopia, no accommodation, and then he develops esotropia. So next question, MCQ 24. True about spasmus nutans is A. Usually begins at 3 years of age. B. Associated with head nodding. C. Jerky and large amplitude nystagmus is seen. D. It needs a surgical management. And your time starts now. The correct answer here is associated with head nodding. So only one is associated with spasmus nutans, and it is seen in the age group of 3 to 18 months of age, where a nystagmus which is fine and pendular. Head nodding is seen, torticollis is seen, that is an abnormal head posture as shown in the figure there. It usually resolves by 3 years of age, and a rare association can be in the form of neurologic dysfunction and glioma of chiasma. It can happen query because of iron or vitamin D deficiency, it is believed. Now coming to the last question in section 5. All are true about lacrimal gland tumor of adenocytic variant, except A. Peak incidence is seen around 60 years of age. B. It has a well-defined capsule. C. It spreads through the perineural tissue. And D. Metastasis early to the brain. And your time starts now. So all are true. One is not true about the adenocytic type of lacrimal gland tumor. And the correct answer is well-defined capsule. It does not, it has a ill-defined capsule. So adenoid cystic carcinoma of lacrimal gland is usually seen in young or middle-aged, more commonly in women. It is the most common malignant tumor of lacrimal gland, and capsule is not well-defined, and pain is there. you can have 5 variants which are described here, and this particular variant of lacrimal gland tumor metastasis early to the brain. And the early clinical signs of proptosis, S-shaped blepharoptosis. MRI will show ovoid soft tissue mass in superotemporal orbit with irregular margin and bony erosion. Treatment is orbital excitation and adjuvant radiotherapy. Now, I am sure the section 3 and 4 section people who have participated must be waiting for the winners, and it is for section 3 winner, less than 40 years, it is Dr. Preeti from Chennai. Congratulations, Dr. Preeti. And for section 3, more than 40 years, it is Dr. Vijay Lakshmi Balaji from Trichy. Congratulations, Dr. Vijay Lakshmi. For section 4 winner, less than 40 years, it is Prabhav Puri, again from New Delhi. And more than 40, Dr. Rajesh Patel from Bharuch. Congratulations to Vijay Lakshmi, Preeti, Rajesh, and Prabhav. Remember, you are supposed to tune in and log into the Zoom platform at the completion, that is after one more section. So congratulations, keep playing for and try to be a session winner as well. Over to Shilpi for following section.
So this is the last section of today's quiz, and this is again the image-based section. All are true regarding Goldenhar syndrome except. So these are your 4 options, A, B, C, and D, and your time starts now. So the time is over, and the correct answer is option C. So this is facio-auriculovertebral dysplasia. As the name suggests, ptosis is not a feature of this syndrome. You see upper eyelid colobomas, preauricular tags, and lardoscoliosis. Ocular associations are limbal dermoids. Colobomas, it is usually associated with Duane syndrome and microophthalmia. So the next question is, systemic association with the figure shown includes all except. So these are your 4 options, and your time starts now. So the time is up, and the correct answer here is option D. Yes, option D, the pedigree shown is autosomal dominant, while it is a case of a Lawrence-Moon-Beadle syndrome, which is inherited as autosomal recessive disorder. It is more commonly seen in males, and the 6 cardinal signs of this syndrome are truncal obesity, retinitis pigmentosa, mental retardation, hypogonadism, polydactyly, and familial occurrence. So the third question of this section is, which amongst them is not related to the image shown? And your 4 options are, so your time starts now. I think this is a very easy question, and the correct answer is option B. Yes, the figure shows the subluxated lens, which is shown with the blunt trauma. The option B is intraocular foreign body, which is not seen with blunt trauma and is seen in penetrating injuries, while the other 3 options, that is opening of the arcade wound, corneal edema, and choroidal tears, all are seen with blunt trauma. So now the second last question of this session is, manifestations of the condition include except. These are your 4 options, and your time starts now. Yes, time is up, and the correct answer here is option A. Yes, the picture shows the color picture and fluorescent angiography of an angioma. It is a case of a von Hippel-Lindau syndrome. Angioid streaks, which is option A, is not a feature of this syndrome. while the other features like adrenal gland tumor, hypertensive retinopathy because of pheochromocytoma, and cerebral hemangioblastomas are seen in this syndrome. So, the last question of today's quiz is, all of the following are seen in association with the figure shown except. So these are your 4 options and your time starts now. So the time is up and the correct answer here is option D. Yes, this is a case of neurofibromas which is seen in neurofibromatosis 1, which is associated with kephaloid spots, leash nodules, optic nerve gliomas, while the option B showed 8th nerve tumor, which is not a feature of NF1 but is seen in neurofibromatosis 2. So this is a pictorial presentation of the associations of neurofibromatosis 1. With this, we come to the end of today's quiz. I hope you all have enjoyed the quiz. Now over to Prashant sir.
So now we have the last idol whom we would like to introduce. It is Dr. S. Bharti. He has done MBBS and postgraduate degree from SN Medical College, Agra, clinical assistant to the great Dr. Kansky and Mr. R.K. Hitchings in UK. He is a comprehensive ophthalmologist, primarily an anti-segment surgeon, and he has a love for phaco as well as refractive surgery. He's a pioneer in refractive surgery. Phacoemulsification started refractive surgery in 87 with RK and automated keratomeliasis. First to start LASIK in the country in 1995. He also participated in multi-center study on LASIK by Loma Linda University, California, USA, and other associations like he is associated with charitable institutions, Keshav Sagar Eye Research Foundation and Anti. Most importantly, he's such a sober man, an unassuming man, and here we present his interview today.
This is a great feeling to be asked about my journey. In fact, when I finished my MBBS, my last posting in my internship was in ophthalmology. Before that, I had done already my medicine, surgery, and I liked medicine a lot. But during the last 3 months of my internship in ophthalmology, I started liking ophthalmology a lot. Primarily because when I did my surgical internship, people told me that I had a very good surgical hand. And when I went into ophthalmology, I realized that it is a very perfect and balanced mixture of surgery and medicine. So I liked the medical ophthalmology and also the surgical ophthalmology. And so I chose to be an ophthalmologist while I was doing my internship. When I went into the housemanship, the people who knew that I am going to be into ophthalmology for a long time, they started giving me more and more work, both medical and surgical. And I was given to use or operate my patients during my first year of housemanship, and found that I was able to do surgeries, both minor and few major surgeries, with a lot of perfection. At that point in time, I was, interested in going out of the country, and had the opportunity to go to England. After clearing my MS in 1981, I went to England and did my little bit of experience with Jack Kansky. He was a master teacher and a master craftsman surgically. He would teach us throughout the day. During the lunch break, even he wanted to ask and teach. And that was the time when I started having more and more interest in the theoretical, medical, and surgical ophthalmology. So after finishing my stint with Jack Kansky, I came back to India in 1984 and started my practice in 1985. And started with a small area of 300 square foot in East Patel Nagar, and started doing refraction and cataract surgery. And from the day one, I had a slit lamp and a keratometer, and did not, during my time in 1985, majority of ophthalmologists were doing their eye examination with the torch. But I started with the slit lamp and applanation tonometer. So because I was always very fond of doing the best for my patients from day one. And that is how my practice started picking up. Very soon, David Davis from US came to India, and he performed through radial keratotomy surgeries in Delhi. I watched him and I found it very, very promising and interesting. So there was a few books available on radial keratotomy by Caspia. And I went on to study those small manuals on radial keratotomy by Caspia. And then I started doing radial keratotomy. But from day one, I had a keratometer and a pachymeter. So I did it very, very meticulous, workup and then surgical planning. Also, the important fact was that I was initially only doing 8 incision RKs. I never went on to do many, many incisions in the radial keratotomy surgery during earlier times, and but then I realized that couple of patients were being undercorrected after this. So then I went on to use about 12 cuts RK also in some of the cases where power was -6 or more. And I realized that this gives a better results. Cataract is the bread and butter for any ophthalmologist. So I never stopped doing cataract surgery, though I became more popular because of my refractive surgery practice. So from going on from intracapsular to extracapsular to phacoemulsification to femtocataract, I changed in my small career of 36 years. I have changed from the most basic cataract surgery to the most advanced cataract surgery now, and that gives me huge satisfaction because I'm using the best of technologies, which I like, and give the best of the results to my patients. I would say that I was always interested in using the latest technology from day one. So new techniques always give you fantastic results. And I feel that one should not have any reservation regarding using a new technology in all these cases, because when the new technology comes in, it always gives you an opportunity to do a better surgery, better results, and earlier recovery. For a young ophthalmologist, I have 2 points to share. One is be honest. Be honest to yourself, be honest to the subject, be honest to the patient, and be honest to the God. Because ultimately, that is the best policy which will take you forward. And second message is be meticulous. Do whatever you can to the best of your ability. Try to be the best and also most meticulous so that your results are good and they make the patients happy. And thank you very much.
Thank you. Thank you, Bharti sir. You are indeed an inspiration and you are an epitome of entrepreneurship to this young generation. We are sure many people would have watched you and they would be inspired by you to take entrepreneurship to a newer heights. Yes, exactly, young guys. Remember, Honesty is the best policy. It is well said, and so well said by Dr. Bharti as well, that you have to be honest, not only to the patient, but not only to the subject, but importantly to yourself as well as to the God. And finally, he's looking at you. And if you're truthful to yourself, you are likely to achieve good results in a short period of time. So here, so sir, stay with us. Meanwhile, we are waiting for the final winners to come. So we have section 5 winner. Section 5 winner under 40 years category is Dr. Devesh Kumawat from Rishikesh. Congratulations, Devesh. Do join us on the Zoom platform. And Dr. Ritesh Singla from Batinda. He's in the category more than 40 years. So congratulations, Dr. Batinda, Dr. Ritesh. Do join us immediately. And less than 40 years, it is Dr. Sahil Agrawal, New Delhi. And for yes, and
above 40 is Muhammad.
Dr. Mohammad Ibrahim. Again, section 6 winner was again Dr. Shailesh, but as per the rules already elicited and enumerated by us, we can have you as a section winner of only one section. And so it goes to the second fastest finger, and that is Dr.
Muhammad Ibrahim Asif.
It is Dr. Mohammad Ibrahim Asif from Delhi. Congratulations, Mohammad. And I expect you to join us shortly on a Zoom platform. You must have received the link. And now coming to the most awaited, coveted prizes, that is the runner-up and the winner. So the runner-up for below 40 is Dr. Sahil Agrawal from Delhi. Congratulations, Sahil. Do join us immediately. And the winner for category above 40. Below 40. Okay, winner. There is some confusion. Give me some time. Meanwhile, we'll go with the other thing. We have some commercial. As I said, no effort is possible without a generous contribution, financial support from anything. We are thankful to Ashok sir for a micro lab for this wonderful contribution and being supported. This is a commercial break for you.
दो और लोग भी तो आ रहे थे आपके साथ में, आपके बाद में
ऋतु,
हाँ, और अतुल
का पता नहीं क्या हुआ,
ये ऋतु का भाई
इतना ही है. So thank you, Microlabs, Mr. Ashokan and Mr. Navneet, who was instrumental in getting this quiz to this level, and all the financial support you have been providing us for this particular quiz. Really thankful to you. And now it is the time for our felicitation. We are just short of waiting for the final results to come out. Give us some more time. Meanwhile, we will have a chat with the guests who are with us, Dr. Bharti sir and Dr. Ritu Kumar ma'am. Can you just make yourself put on your video as well as audio inputs on? Yes, Bharti sir.
Yeah. Yes, Prashant.
Graduation from Agra. How come you decided your destination to be Delhi?
That's another interesting story. Because when I was in Agra Medical College, I was already offered an ad hoc kind of lecturership. I used to have lecturer, reader, and professor at that point in time, lectureship in the college. But then I had married my batchmate, Dr. Raka, and she was in Delhi. She belonged to Delhi. So I thought that, both of us cannot be there in Agra without her working, So it was not possible. So I came to Delhi, and I'm thankful to her for that.
Sir, you moved away from a town of love to a town of Sasural.
Yeah, to a great extent, yes.
So I think the credit, as always said, goes to the better half.
Yes.
Otherwise,
agree.
Dr. Bharti would have been relegated to a small town called Agra, while he is now the king of Delhi.
No. I'll tell you, it is better to be in a small town where you are known by, everyone really, rather than be in a crowd and be a, good guy. So a small town is always better. Delhi is too vast a place. Yeah, but this gives you more opportunities, of course.
Yes, sir. In spite of being such a big town, so much of a crowd, you have made a mark for yourself, and we salute for your efforts. From a small town guy to a big don from of a big city now. We salute you, sir, and you are an inspiration to us as well as to the younger generations.
Thank you.
Ritu ma'am, you also belong purely to Delhi, or what do you say about?
I'm completely Delhiite, 100%.
Okay.
No adulteration.
But your personality speaks about not very, type of a female who is in a metro type of a lady. You are so soft spoken, so belligerent.
You haven't actually seen me. You haven't seen me actually. This is a modified version.
No, we have always seen you at various forums, ma'am. We always are in awe with you, and that's why today you are sharing the dais, and you are an inspiration today, hero of our show today. So what is it, ma'am? Why did you think only about cornea? Was cornea in those days really that passionate? Or in those days, I think retina was the only subspecialty which was very highly talked about.
No, I did my post-graduation from RP Center, and I finished in May of 86. And then after that, we get the senior residency. So I did my senior residency also in RP Center from August 86. And August 86 to August 89, 3 years. So the unit which I got posted was cornea unit. And I was under Dr. Madan Mohan. And so there again, it was an absolute specialty concept, and then you couldn't change here and there. So one did 3 years of rigorous cornea at that time. But after finishing my cornea 3 years in 89, I realized I knew very little of retina. I didn't feel any confidence that way. Then I did 2 years of retina as a pool officer again in RP Center. So I did all retinal surgeries, all whatever could have been done. And I used to assist that time very often Dr. Atul, and learned a lot from him at that time. So in 91, when I joined this current place, Maulana Azad Medical College, because that's where I got the job. And I came here fully prepared to be doing retina, because by this time I had developed passion for that. And cornea, somehow, one wasn't seeing all those good results at that time. I mean, the results at that time were stark opposite of what we get now. Maybe quality of tissue, quality of preservation, and everything. So I wanted to do retina. But when I came over here, the boss, Dr. Gupta here, he said, please develop eye banking, because he knew that I had 3 years of cornea. So he said, develop eye banking in this place. So that was Guru Nanak Eye Center in Maulana Azad Medical College. So I had no option. I mean, I was just 2 months old in my new job. And if your boss tells you to do this, you have to do this. So I started from the scratch for eye banking, cornea. And the day I still remember, 17 September 91, when I was told that you're going to do cornea, I cried. Because I said, oh, all my life I'm going to see again those kind of grafts, that time, what is this? But gradually, slowly, and we had no MK medium. They were like whole globes, which used to be there, and absolutely fresh eyes. So one had to do the surgery in 6 hours. So I used to rush, very quickly, do the surgery as fast, and one started seeing good results. So, and I continued to do retina till 2002, till I developed presbyopia. And then I said, okay, now I am fully concentrating on cornea. So that's how the journey has been.
Ask you the next question. Meanwhile, let me declare the winner so that they can join us on the Zoom platform. So section 6 winner above age 40 is Dr. Praful Nakar from Mumbai. Congratulations, Praful. Please do join us on the Zoom platform. And also we have now session winners ready. So the session winner, the first runner-up for today's less than 40 category is Dr. Sahil Agrawal from Delhi, and first runner-up, that is for above 40 years category, is Dr. Venkat Subramaniam from Bangalore, who was also the section 1 winner. And the final prize, the most coveted prize, that is winner for less than 40 years category, is Mohammad Ibrahim Asif from Delhi. Congratulations, Mohammad Ibrahim. And above 40 years category is Dr. Shailesh from Bangalore. So congratulations to the winners. Meanwhile, we continue with the chat. You are requested to join us on the Zoom platform for the felicitation ceremony. So back to you, ma'am, here.
I must congratulate all the winners.
Thank
They've
you.
worked very hard.
Yes.
And maybe hard work for you also.
Thank you,
the quiz is not easy. It's
Thank you,
not
ma'am.
easy.
Thank you, ma'am, for your appreciation. But coming back to the question which we were following, we were having the discussion. We were usually taught you follow the passion and it will lead you to success. While you are talking, you had a passion for not for cornea, but you developed passion and love and still excelled in that field. Is it not a contradictory, or what would in fact, when we teach our students or children, we tell them, follow your passion. And if you follow your passion religiously, you should be reaching the top. While you are a lady who was forced upon a subject and you develop passion and love and see where you have reached. So it can be either way. What do you say about that particular thing?
I agree. The traditional saying is follow your passion and the way will open. But then what do you do if it doesn't? You could be in a situation when it's completely opposite to what you thought it would be.
No, ma'am.
So can't run away from that situation. So I've learned in life to compromise with whatever situation you've got and make the best out of whatever situation you are in.
Exactly, ma'am. That's what the viewers, younger generation, remember. Not necessary in life you get what you want or what you might have deserved in life. But sometimes life gives you a different turn and it forces upon you certain choices. Well, if you follow madam's path, you develop a love, whatever has been forced, and probably it would no longer be a force. You can excel and perform well, as Dr. Ritu has done in her subject. We really are in awe with you, ma'am. We salute you for this particular advice, which has come for the younger generation, because usually all of my previous heroes who had been on our shows always spoke about following a passion. You are the first contradiction, I should say, if you permit me to say that. But you have shown this younger generation, yes, whatever life comes, take it in a stride, accept it and love it. And definitely you can follow it. We salute you for this wonderful effort, ma'am. So be with us. Now we will start our felicitation ceremony. Sai, are you ready with the felicitation ceremony? All people have joined us.
Doctor, just 1 minute, Doctor. I'm taking live.
Okay. Till then, I can have another question for Dr. Bharti sir. Bharti sir, दिल्ली इतनी बड़ा शहर है, पैसा कैसे आता है? पैसा कहाँ से आया? आप तो छोटे गांव के, कि पहले से you were born to a rich father?
When I came into Delhi, I had no money, absolutely. So I have already spoken in my journey that I took a space of 300 square foot on rent. After coming back from England, and to tell you honestly, when I went to England, by that time I had collected some 5,000 rupees, which I spent in buying a ticket to England, return ticket. That was the cheapest airlines, the Ariana Afghan airline, which took me 2 days to reach London. It was just like a rail journey. So it took 2 days to reach Delhi to London. So, but as I said, if you are meticulous, if you're doing everything well, if you are not kind of shunning any work, thinking that it is below your dignity, if you're ready to do refraction, if you're ready to do everything, which is, I feel that that is the prerequisite for doing everything. And then if you know how to do all these things well, the other thing was that I must thank my professor during my post-graduation days. Once he saw me doing cataract surgery in a camp. We were having a lot of camps going outside Agra and doing so many camps, doing 200, 400 cases every time. So once there was no electricity, so he showed me torch while I was operating a cataract, because we were doing intracapsular at that time with Arugas forceps. So when he saw me doing surgery, he developed confidence and always told me that if there's, you can do all these cases, go ahead and do them. And if there's a problem, tell me. So that kind of confidence, if a professor gives in into you, then that is, something which gives you a lot of confidence yourself that, okay, I can do these things very easily. And by the time I finished my MS of 2 years, at that time it was 2 years, I had done more than 3,000 cataract surgeries. So when I came into practice, I had sufficient experience, which is slightly, kind of unfortunate situation now that people, the boys and the girls, the students do not get so many cataract surgeries. No, basically surgical exposure is much less compared to what was there in our time. And when I did, we did it, and I could, do surgeries without any fear in my mind. That was the thing. And without any fear was something which took me forward, because I always, and the second thing which I appreciate and I want to convey is that when we teach our students, I felt that my boss, my professor gave me a confidence that, okay, you start doing, if you face any problem, I'll take care of the whole thing. Whereas if you are told time and again that if you do this, this can go wrong this way, if you do this thing wrong, this will go bad, and like that, if you teach them more complications, the person is slightly, already in a situation where his mind is more scared of doing surgery, that, okay, if I do this thing and this complication occurs, the eye patient will lose the eye. Whereas in our cases, they taught us how to do it perfectly, and they are at the backup always. So those two things are, I think, yeah, that is a big city doesn't matter at the end of the day.
Sir, you are a clinician par excellence, but here you are to us a hero because you made a mark at a small town boy making a mark in a big capital. So that is the reason why today you are with us. Besides your clinical acumen, we salute you for that. So what does it take in a single sentence, I should say, to make a big mark? Is there, they always say that this place is saturated, this town is saturated. Is there any word called saturation? Was it saturated when you went to Delhi, or you created a space in spite of saturation? Because the common excuse today generation gives is that this town is saturated, so I would not go into practice and all those things. What do you say this guys?
You have to make a mark wherever you are. Whether it is saturated, unsaturated, available, no space. You have to make your space. And I think the two things which are very, very important, and that is going to take the 2H. That is honesty and hard work.
Okay. Thank you, sir. Last question to Ritu ma'am before we start our felicitation ceremony. Ma'am, younger generation is watching. One is seeing a good entrepreneur who made a mark, and another, we are seeing another Dr. Ritu Arora at the other end, who has made an academic front proud of, means proud. So whom should these guys follow? An academician or an entrepreneur? What would you say? What makes you happy to be, in spite of being such a beautiful clinician, a great surgeon, and so contented in a government job teaching people? What is it that keeps you going?
I think what keeps me going is the happiness of my patients. That's what ultimately. Happiness of my patients and being able to diagnose things properly and they get treated and a smile on their face. That's what keeps me going. And nothing more than that. And the current scenario, ophthalmology is a very high investment zone practice. So if you have a good backup, jump into practice. Otherwise, it's very difficult.
I can understand, ma'am. Thank you once more, both of you.
Now I'll interrupt. That was one more H. Happiness of the patient.
Exactly. No, looking at the patient like a god and working for their betterment is what the younger generation should reach, rather than what this patient can give me. If this is the theme, if we work on, be it in a government setup, be it in a private setup, it is a recipe to the success. We are sure we will do excel well in this. Now, coming back to the felicitation ceremony. Yes, sir, you will be felicitating all the winners of section sections less than 40 years, while madam will be felicitating above 40 years. So the first winner, yes, guys, all the winners, you are on the Zoom platform, so please put on your videos on audio input as well. So section 1 winner, less than 40 years, it is Dr. Amok Kittur from Delhi. Yes, Amok, come over here, and Dr. Sudhan Bharti will be giving you the all the winners. You are on the Zoom platform, so please put on your videos on audio input as well. So section 1 winner, less than 40 years, it is Dr. Amok Kittur from Delhi. Amok, are you there?
Yes, sir.
Ah,
Yes, sir, I can hear you.
Yeah, congratulations, Amok. And this is a gift voucher for you. And Dr. Bharti, sir, you can just pat him, you can ask him a question, such a
Yes, so much, sir.
No, I appreciate his knowledge, his effort.
Sir, I can hear you.
Congratulations.
Thank you so much, sir.
Amok, where are you from?
Sir, I'm from Delhi. I'm actually from Karnataka. Now I'm studying in RP Center, junior residence.
Okay. I think, Sai, there is a echo somewhere. Can you please put off the echo?
Thank you so much, sir.
Amok, where are you from?
Sir, I'm from Delhi. I'm actually from Karnataka. Now I'm studying in RP Center,
Sai?
junior residence.
Okay.
Just a minute, doctor. I'm looking at it.
Yeah, just look at it because it's repeating the whole thing.
Is it clear?
Yeah. Yeah, there is no echo now. Okay. So Amok Kittur, congratulations for being a section 1 winner.
Thank you again, sir.
See, again it is repeating. Sai.
Is it clear?
Yeah, there is no echo now. Okay. Even now there is echo. Congratulations. It is repeating. I don't know what.
Thank you again.
See, again it is repeating. Sai. Is it okay now? Shall we go ahead? Even now there is echo. It is repeating. I don't know what. Is it okay now? Shall we go ahead?
Doctor, can you unmute yourself now?
Yeah, I have unmuted. Is it okay now? I think it is fine. So the section 1 winner in the category above 40 years, Dr. Venkat Subramaniam from Bangalore.
Doctor, can you unmute yourself now?
Yeah, I have unmuted.
Thank you, sir. I'm not able to unmute my video. Thank you.
So the section 1 winner in the category above 40 years, Dr. Venkat Subramaniam from Bangalore.
Yes, sir. I'm able to unmute myself. I'm not able to unmute. I'm not able to unmute my video. Thank you. Thank you very much. It was a great privilege. Wonderfully conducted, sir. Thank you very, very much. Yes, sir. I'm able to unmute myself. I'm not able to unmute. Thank you very much. It was a great privilege. Wonderfully conducted, sir. Thank you very, very much. Yes, sir. I'm able to unmute myself. I'm not able to unmute.
Sai, is there the similar problem at your end?
Yes, doctor, I can also hear it. Just check, doctor, in your computer whether you're on another system also, means your backdrop, the Zoom platform, other than the other one, other live platform is going on?
No, everything is off. Similar problem at your end? Everything is off at our end. Me and Shilpi are sharing the same.
Doctor, in your computer whether you're on. Okay, let us go ahead, doctor. We can't.
Okay. So the section 2 winner, less than 40 years, Dr. Prerna Sinha. Can you unmute yourself? And Dr. Sudhan Bharti, sir, congratulate her.
Okay, let us go ahead, doctor. We can't.
Congratulations, Dr. Prerna.
Good evening, sir. Thank you so much.
For wonderfully performing wonderfully. Congratulations.
Thank you, sir.
What do you do, Dr. Prerna?
Sir, I'm senior resident in AIMS Patna right now.
Great. Congratulations. Keep playing. And next time we would like to see you as a session winner. Okay.
Thank you, sir.
So now section 2, Dr. Shailesh from Bangalore. Dr. Shailesh, can you unmute?
In AIMS Patna right now.
Great. Congratulations. Keep playing. And next time we would like to see you as a session winner. Okay.
Thank you, sir.
Dr. Shailesh, section 2, Dr. Shailesh from Bangalore. Dr. Shailesh, can you unmute? Is he there? Sai? Okay, so we move on to the next. Section 3 winner is Dr. Preeti from Chennai. Dr. Preeti? Dr. Preeti? Okay, she is not there. So congratulations, Dr. Preeti. Section 4 winner, less than 40 is Dr. Prabha Puri. Prabha, you are always there. Where are you?
Thank you, sir. Thank you so much.
So Bharti sir, you can, he's from your Delhi guy.
He's a champion. Prabhav, you were a champion. Congratulations once again.
Thank you so much, sir.
Now the section 5, less than 40 is Dr. Devesh Kumawat from Rishikesh. Devesh, are you there?
Yes, sir. Thank you, sir.
Congratulations, Devesh. What do you do?
Sir, I'm working as assistant professor at AIMS Rishikesh.
Kya baat hai. Good, good. If you have good teachers, I'm sure we will have a good breed of ophthalmology in coming future.
Yes, thank you, sir. Thank you, sir.
And section 6 winner is Dr. Sahil Agrawal from New Delhi.
Assistant professor at AIMS Rishikesh.
Are you there?
Yes, sir.
Sudhang sir,
Thank you, sir.
Yes.
Congratulations. What do you do?
Sir, I'm working. It's quite echoing. I cannot understand what you are saying right now.
Kya baat hai. Good, good. If you have good teachers, I'm sure we will have a good breed of ophthalmology in coming future.
Thank you, sir. Thank you, sir.
And now we come to the section winners above the age 40. Section 1 is Dr. Venkat Subramaniam. Venkat Subramaniam. Kya ho raha hai?
Yes, sir. I'm able to hear you. I'm not able to on the video.
Okay, what do you do, Venkat?
I'm a retinal surgeon, sir, practicing. Have my own hospital. It was wonderful relearning and reliving some old memories, sir. Thank you very much.
So you get a gift voucher from Dr.
I'm not able to on the video.
Okay, what do you do, Venkat? Ritu Madam. Dr. Ritu Madam, you can interact with Dr. Venkat and congratulate him and say, give him the gift voucher virtually.
Many congratulations, Dr. Venkat. Superb job. And please keep excelling. Keep excelling.
Thank you, ma'am. Thank you. We learned a lot through your teachings today and your experience. Really, that's been a biggest blessing of mine. Thank you.
Thank you. Thank you, Venkat. Now, section 2 winner above the age of 40 years is Dr. Shailesh from Bangalore. Dr. Shailesh.
Thank you. We learned a lot through your teachings today and your experience. Really, that's been a biggest blessing of mine. Thank you.
Dr. Shailesh, are you there? Venkat. Now, section 2 winner above the age of 40.
Conveyed he couldn't join, Prashant, sir. Sorry.
Okay, fine. Section 3 winner is Dr. Vijay Lakshmi Balaji from Trichy. Dr. Vijay Lakshmi. Dr. Shailesh, are you there? Dr. Vijay Lakshmi.
Conveyed he couldn't join, Prashant, sir. Sorry.
Okay, fine. Okay.
चलिए तो अपन से चलते रहेगा इसको.
Okay. Dr. Rajesh Patel from Bharuch, he is a section 4 winner in the category more than 40. Rajesh Patel, sir, are you there? Dr. Vijay Lakshmi. Okay. We move to the section 5 winner above the age of 40, Dr. Ritesh Singla from Bhatinda. From Bharuch, he is a section 4 winner in the category more than 40. Dr. Ritesh, are you there?
So he's joining in a minute.
Okay. Okay, he's yet to join. And section 6 winner is Dr. Praful Makar from Mumbai. Dr. Praful. Dr. Ritesh Singla from Bhatinda. Dr. Praful Nakar, are you there? Okay, congratulations to all the winners. They can join us. We congratulate you. Now coming to the main session winners. First runner-up in the category less than 40 is Dr. Sahil Agrawal from Delhi. Sahil, are you there? Bharti sir, you have to congratulate him and hand over virtually the gift voucher.
Thank you so much, sir.
Sahil, can you put down your mask? We can't see you so well.
Yeah.
Bharti sir.
Right now, sir, I am working as a senior resident.
Yeah, good. Congratulations once more, Sahil.
Thank you so much, sir.
In the category more than 14 years, the runner-up is Dr. Venkat Subramaniam from Bangalore. Dr. Venkat, please again.
Right now, so I'm working as a senior resident.
I think there is some problem, technical glitch. That's why we are having it. And Dr. Venkat Subramaniam.
Thank you, sir. Thank you very, very much.
Congratulations for being runner-up, and keep playing. Next time, we would like to see you in the category as a winner-up.
Thank you. Thank you very much, sir. And really wonderful the way Brain Teasers have been running through. Thank you.
Thank you. Now coming to the most coveted, that is the winner. And the winner in the category less than 40 years is Mohammad Ibrahim Asif from Delhi. Mohammad Ibrahim Asif.
Thank you, sir.
Congratulations. And I
Thank you.
request Bharti sir to congratulate him and hand over virtually the gift voucher.
Please, Professor Ritu also join for this championship trophy.
Thank you, sir.
Thank you.
Many congratulations, Dr.
Thank you, ma'am. Thank you, ma'am.
Many. So what are you doing?
I am working as a senior resident in RP Center, AIMS.
Okay, great. Many
Yes, ma'am.
congratulations. Please keep doing that.
Yes, ma'am. Thank you.
Now the last prize, that is the winner of the category more than 40 years, is Dr. Shailesh from Bangalore. Dr. Shailesh, are you there? And I request Dr. Ritu madam as well as Sudhang Bharti sir to simultaneously felicitate and hand over virtually the gift voucher. Dr. Shailesh from Bangalore for being the winner-up. Congratulations.
I don't think he's there because he was not there earlier too.
Yeah.
But
true.
anyway, many congratulations in absentia.
Okay.
Which
And
can be
by Dr. Ritesh Singla, who was a Section 5 winner in category more than 40 years, has joined us. Dr. Ritesh, are you there?
Yes, sir. Yes, sir, I'm here.
And I would like to congratulate him, Dr. Prashant. He's our ex-student.
Oh, yeah.
Thank you, ma'am. Thank you so much.
So I wouldn't give this privilege to Dr. Bharti.
No. He's your student.
I'm a student from Guru Nanak Eye Center. I mean, I think when did you
It's
pass
such-
out, Ritesh? Maybe 2003, 2004, something like that. Isn't
Yeah,
it?
I passed in 2004, ma'am. 2001 to 2004.
So I wasn't that off. Yeah. So many congratulations, and he's doing very well in Bathinda.
Thank you so much, ma'am. Thank you.
Congratulations, but Ritesh, for joining us. We are so proud of you, and next time, Madam would like to see you as a runner-up or a winner of the whole session. Remember that. So
We
it's
would.
the onus on you to continue playing in future as well.
Yes.
So
Thank you so
we
much,
are
sir. Thank you.
So we are at the end of our felicitation ceremony. Once more, dear friends, thank you everyone for participating, and special thanks to Dr. Ritu Madam and Sudhang Bharti sir for sparing their such a valuable time and encouraging this young generation who are with us. We are sure with your inspirational stories, this young generation will take more lead and more leap in the future, and they will make us proud Indian ophthalmology. Thank you once more as Bharti sir and Ritu Arora madam. And once more, thanks to Microvision for being financially supporting us so strongly, and Saif Numerotech for all the technical backing. Thank you. And friends, remember our monthly quiz is on 3rd of January between 11 to 1 p.m. So don't forget to log in and also spread the word so that more people participate. Looking forward to meeting you all. Thank you once more. Bye-bye. And you all a happy new year.
Thank you, Dr. Prashant.
Christmas
And
and
Dr. Yeah, we'd like to say thanks to Dr. Prashant and Dr. Shilpi for conducting it very superbly.
Absolutely.
Thank you. That's the thing. Yeah, we hope for it. Yeah.
Thank you. Thank you. Bye-bye now. Bye. क्या हो गया था?